Hi, my name is Jessa Orbeta and I'm a student physical therapist assistant. Today I want to discuss physical therapy and scleroderma. Scleroderma is also known as systemic sclerosis. It's an autoimmune disease where there's increased fibroblast activity causing the skin to harden. There are two types of scleroderma. The first one is limited scleroderma, which affects the face, the forearms, and lower legs. This type of scleroderma is more common. The next type is diffuse scleroderma, where it affects upper arms, thighs, and the trunk and can also involve organs. Some of the secondary impairments include gastrointestinal issues and interstitial lung disease, where the tissue in the lungs becomes scarred and thickened. The purpose of this study was to look at the effect of intensive aerobic exercise and muscle endurance training on patients with either limited or diffuse scleroderma. This study took place in Stockholm, Sweden. The study took place over a course of 8 weeks, where patients were required to exercise 3 times a week. There were 4 participants, 3 women and 1 man. Their age ranged from 41 to 69 years old. Their forced vital capacity ranged from 50% to 100%. Forced vital capacity is the maximum volume of gas exhaled after full inhalation. The greater the volume of gas exhaled, the more efficient the lungs are at expelling gaseous waste. The exercise program that the scleroderma patients participated in had 2 parts. The first part was aerobic exercise on a stationary bike. There was a warm-up period for 10 minutes, followed by 15 minutes of heavy exertion, and then finally a 5-minute cool-down for a total of 30 minutes. The second part was dynamic muscle resistance training. During shoulder flexion, the patients are seated with both arms at their sides. On each wrist, they had a 1 kilogram cuff weight. They are to move one arm forward and up towards the sky and then back down, then repeat that same motion on the opposite arm. If 60 repetitions are completed successfully, then that weight would be increased. During hip flexion, the patients are laying down on their back. They are to bring one knee towards their chest and then back down, and then repeat that motion with the opposite leg. If they complete that for 60 repetitions, then an ankle weight would be added. The therapist used 3 types of tests to see if there were any improvements in any of their patients. Each test was administered every 2 weeks. The first test was a 6-minute walk test. During this test, the patients are instructed to walk as far as they can at a self-selected pace for 6 minutes, and the distance would be measured in kilometers. As we can see in the chart below, there was no significant change in the distance that they were able to walk after the 8-week exercise program. The second test that they used was the submaximal treadmill test. This test was used to track the patient's oxygen intake. During the 8-minute test, the patients are walking at a self-selected pace on the treadmill with a mask over their nose and mouth. That mask is used to measure the concentration of oxygen in their breaths. They measured that by milliliters of oxygen per kilogram of body weight per minute. During the first 4 minutes, the treadmill is horizontal, and in the last 4 minutes, the treadmill is at a 5% incline. As you can see in the chart below, during the 8-week exercise program, participant number 2 and 3 improved their aerobic capacity. The last test they used was the Functional Index 2 test. This was used to measure the muscle endurance during shoulder flexion and hip flexion. If they were able to complete 60 correct repetitions of each motion, it meant that they had no functional limitation. The first chart we have here is the shoulder flexion. Participant number 2 and 3 improved their shoulder flexion muscle endurance by more than 20%. The second chart measures hip flexion. As you can see, patient number 2 3, and 4 improved their hip flexion muscle endurance bilaterally. Overall, this was a good study with positive results. It showed that patients with scleroderma can benefit from an exercise program with physical therapists. As we saw, 2 participants were able to increase their oxygen intake, and 3 participants were able to improve their muscle endurance. Unfortunately, some of the participants suffered with arthritis in their ankles. This could have affected their performance during the test and during the exercise program. This was a small study with only 4 participants, but that could be due to the fact that scleroderma is a very uncommon disease. But the ratio between female participants to male participant was very accurate, since a lot of scleroderma patients are females. The last 2 slides are my references. Feel free to check them out if you want to do further research. I will leave my contact information in the description below if you have any questions or concerns. I thank you very much for your time.